Okay, so I'm going to discuss removing a bedpan, or putting a patient on a bedpan, removing the bedpan, and really quick I'm going to talk about removing a Foley. So first we're going to make sure that we have an order to remove the patient's Foley, and then we'll go into the patient's room and explain to them. We'll do patient education as to why we're removing a Foley, and also we're going to explain to them that it may take a while for their bladder to wake up from having the Foley, that it might take a minute for the bladder to be able to tell them that it's full. We'll also tell them that they have so long until they have to urinate, or we may have to straight cath or insert the catheter back in. So we'll make sure they know all that. So I don't have my Foley kit with me anymore from the previous video, but I'll just explain that before you remove a Foley, you want to make sure that balloon is the water is sucked out of the balloon holding the Foley in. You want to make sure how many cc's you inserted, and you can check that because you should have documented how many you put in the balloon. So you'll make sure you pull out the exact number of cc's of water as you put in, and then you'll tell your patient to take a deep breath, and while they're exhaling, pull it out kind of fast, and then clean everything up. And then I've always offered them a rag, because sometimes I don't know, they just feel kind of gross, so I always offer them something to clean up with, or if they can't, I'll do it. So next I'm going to talk about bedpan, putting a patient on a bedpan, taking them off. So putting a patient on a bedpan, I don't have one, so I'm just going to explain it. If they are able to, I will ask them to bend their knees and push up with their heels and lift their hips, and you can position them or put the bedpan underneath them. But a lot of times they're not able to, so I will have them roll to the side that's easier for them to roll on, or a side that isn't hurt, like broken hip or anything. And then I will put the bedpan kind of underneath them, and I'm going to hold it in place whenever they roll back. And then once they roll back, I'm going to make sure that they're on the bedpan pretty good, because we don't want to mess, and the patient doesn't want to mess because it's embarrassing. And I'm going to try to provide them privacy. I usually cover them back up with a blanket, raise the head of their bed, make sure their knee of the bed does not elevate, make sure it stays down, elevate the head of the bed as much as possible. And I know that's not, and patients with broken hips, we can't elevate it too much. So after they're finished, also make sure not to leave them on the bedpan for very long, because it can cause skin breakdown. So as soon as they're finished, if they're able, have them raise up. If they're not, have them roll. And whenever they roll, it's hard to explain, but you always hang on to the bedpan, because if it rolls with them, it's spilling everywhere. So kind of hold it to keep it in place while they roll off. Kind of hold it to keep it flat while they roll off, and then just remove it. And then if they're able, I always offer a wet, warm washcloth, so they can clean themselves up. But if they're not able to, I will. And I always usually just use soap too, because it's just a good way to get some peri-care done, and they probably need it done anyway. And then I'll document how much they urinated, or if they had a bowel movement, and I'll chart the characteristics of that as well. And also when I remove the Foley, I'll chart how much urine is in the bag, and I'll chart the characteristics, and I'll chart whether they're able to urinate within a certain amount of time or not. And then before I leave the room, always make sure they have a call-eye, ask them if they need anything else. And before I do anything, I'm always going to wash my hands and put on a pair of clean gloves.